Welcome back. In our previous explainers, we looked at the friction in India's health claims system and saw why simple digitization wasn't the answer. So now it's time to understand the solution at its very core. We're going to break down exactly what the National Health Claim Exchange, or NHCX, really is in plain and simple terms. So here's our roadmap. We'll quickly touch on the current reality of claims just to set the stage. Then we'll define NHCX, what it is, and just as importantly, what it isn't. From there, we'll see how it transforms daily operations, look at the core principles of interoperability and trust that make it all work, and wrap up with the vision for a truly connected future.
All right, let's start with Section 1. To really understand why NHCX is so necessary, we have to first ground ourselves in the current reality of the claims ecosystem. You know, this statement right here, it's not just some abstract concept. It's the day-to-day struggle for practically everyone involved in healthcare in India. It doesn't matter if you're a hospital, an insurer, or a TPA. This friction is a constant drain on your operations.
So what does this friction actually look like? Well, for hospitals, it's the incredibly long wait to get paid, which puts a huge strain on their cash flow. For everyone, really, it means massive operational overheads, thanks to all the manual work and the fact that every single payer has a different process. Communication is just a chaotic mix of phone calls and emails, which, as you can imagine, leads to a system with very little trust and almost no transparency. So how do you fix a system this broken? You can't just apply a bandage. You need to build completely new, modern infrastructure. And that brings us to Section 2. Introducing the National Health Claim Exchange. The easiest way to think of NHCX is as a standardized digital highway built just for health claims. Now, it's crucial to understand that NHCX doesn't process the claims itself. Its job is to be the secure, reliable road that all the information travels on. In essence, it's the central traffic controller that the ecosystem has been missing for years.
Now, this next part is really important. To truly understand NHCX, we have to be crystal clear on its specific role. So in this section, we're going to clarify what NHCX is, and perhaps even more critically, what it is not.
Here's the absolute key distinction. NHCX is a secure information router, a gateway, a traffic controller. Think of it like a highly efficient digital postman. What it is not is a giant database. It does not store patient files. It's not another portal that you have to log into to process claims. And it definitely does not act as a judge or adjudicator to decide if a claim gets paid. Its only job is to get the right information to the right place securely. So how does it manage this without seeing sensitive information? Well, the entire system is built on a principle called privacy by design. Let's use an analogy. Imagine a hospital puts all the sensitive clinical data into a sealed, locked box. They hold one key, and the insurance company it's going to holds the other. NHCX is simply the courier. It can see the address on the outside of the box, that's the header, so it knows exactly where to deliver it, but it has absolutely no key to open that box and see what's inside. Okay, so we've established what NHCX is. It's a secure information highway. Now, let's get practical and move on to Section 4. How does this new infrastructure actually translate into real, tangible improvements for those frustrating, high-friction tasks you deal with every single day? At its core, NHCX streamlines 5 key operational bottlenecks. First, those painful coverage eligibility checks, they get automated, giving you an answer almost instantly. Second, pre-authorization requests are streamlined, which drastically cuts down on waiting times. Third, you get a uniform, standard way to submit all claims, no more custom paperwork for every single payer. Fourth, payment notices are also standardized, giving hospitals clear and predictable visibility into their finances. And finally, all communication happens through a formal, trackable channel. No more vital information getting lost in random phone calls or emails. Now, a system of this scale can't function without a rock-solid foundation. And that foundation really comes down to 2 simple, non-negotiable principles, which we'll cover in Section 5, interoperability and trust. So, what exactly is interoperability? Well, you can think of it as a shared language or a common grammar. Before, every hospital and insurer essentially spoke their own dialect, which led to constant miscommunication. NHCX solves this by making sure everyone speaks the same globally recognized language, called the FHIR standard. This is a real game changer because it means information sent from a hospital system is perfectly and automatically understood by an insurer's system. No manual translation needed. And that shared language brings us to the second pillar, trust.
because there's no point in speaking the same language if the conversation isn't private. As we've already seen, all sensitive data is encrypted from end to end. The trust is literally built into the technology. The hospital locks the message, and only the intended insurer can unlock it. NHCX is just the trusted courier who delivers the sealed letter, but can never, ever read its contents.
All right, let's bring it all together in our final section. We've seen the problem and the solutions architecture. Now let's look at the bigger picture, the connected future that NHCX makes possible for India's entire health claims ecosystem. When you put all of these pieces together, what does the future look like? It's a future where hospitals can finally breathe because they're not being crippled by these long, unpredictable payment cycles. It's one where operational costs are driven down for everyone. For patients, it means the promise of cashless claims becomes a smooth, fast, and reliable reality. And looking even further, this trusted foundation paves the way for serious innovation, like true auto-adjudication and much smarter fraud prevention.
So in the end, NHCX isn't just another small upgrade. It represents a critical, necessary evolution. It's the foundational infrastructure designed to finally move the Indian health claims system from a fragmented, manual past toward a future that is truly unified, transparent, and automated. And so I'll leave you with this final thought. As this digital backbone becomes the new normal, as it gets stronger and more deeply integrated into our daily work, how will a truly efficient and connected claims ecosystem reshape not just the paperwork, but the very future of healthcare delivery in India?